Triestman, and I want to tell you how I can get you back to what you want to do as fast as possible and keep you there. Whether it be mountain biking, road biking, running, swimming, paddling, climbing, golf, tennis, or just plain old life. We're going to do this by combining history and review of systems, orthopedic examination, chiropractic examination, neurologic examination, active release techniques examination, selective functional movement assessment, and, if needed, imaging and blood work. The history and review of systems helps us identify causative and contributing factors so that you can stay better longer. The orthopedic examination. There are many orthopedic tests. The straight leg raise is the one that is most often used and most researched. We raise the patient's leg, and this tightens the sciatic nerve. And depending on when, where, and the character of pain, tells us what tissues are involved, whether it be disc, muscles, ligaments, tendons, fascia, or joint capsules. The neurologic examination. We first test the muscles, and the extensor digitorum longus is the muscle test for the L5 nerve. We next test sensation, like this. Finally, we test the patellar reflex, which tests the L4 nerve. We then do the chiropractic examination, which starts with postural examination, then goes to segmental alignment, and then goes to segmental movement. We then do the active release techniques examination. Active release techniques is the gold standard in soft tissue treatment. Soft tissues being muscles, ligaments, tendons, fascia, joint capsules, and nerve sheaths. If needed, we will perform imaging, like X-ray and MRI. We also do blood work for back pain. If we're concerned about nerve health, we'll look at vitamin B12 and folic acid levels. If we're concerned about arthritis, we'll look at C-reactive protein and sedimentation rate. We take all this information and we come up with a diagnosis and a powerful treatment plan solution. This will be based on what you need and what you want, and will be a combination of traditional chiropractic, active release techniques, science-based rehabilitation that will incorporate Pilates, yoga, strength training, and functional training. This will be at a level that a professional athlete will get, and will have an emphasis on self-care. You will also get a video to take with you that will be of the session of that day, so that you can practice the exercises at home, gym, work, or wherever you have technology. We schedule appointments on the half hour and hour so that you don't have to wait and that we have adequate time to take care of you. How much do things cost? We will bill or submit to the insurance company for you. First visit is $135. Follow-up visits are $85 for a half hour, which is the most common, and $175 for a full hour. How long will it take you to get better? Previous episodes and how long it took you to get better tells us an enormous amount of information. Do you have areas adjacent to or next to the painful area, the hip being the best example, that have been irritated, injured before? Evidence of irritation could just be stiffness. Do you have health problems that might interfere with healing? Diabetes being the most common. Factors that speed healing. A history of fast healing. A high level of motivation or commitment. My training. I am a graduate of New York Chiropractic College. I have 25 years of practice experience. I also have a 3-year degree in nutrition called the Diplomat in Nutrition. I am Master Certified in Active Release Techniques. I am an avid recreational athlete. I have worked as part of the medical team for the Ironman in both Kona and Tahoe. I have also worked as part of the medical team for the Great Race, the Killington Stage Race, and the New York Marathon. My passion was ignited by my dad, a 1948 graduate of the New York Chiropractic Institute. He was the longest practicing chiropractor in New York State, 62 years. My passion has continued with 5 to 10 hours of study per week, 375 hours per year. I study books, journals, podcasts, and seminars. I have more than 50 hours continuing education hours per year. The state requirement is 24. I have continued to teach both professionals and the public through seminars and podcasts and webinars. The things that continue to ignite my passion: I love learning, my quest to be the best, being part of your healing process. This is priceless. Watching and guiding people get healthier. Watching people metamorph into healthier people. I love getting people better. Conditions that I treat: low back pain, neck pain, carpal tunnel syndrome, lateral epicondylitis, also known as tennis elbow, medial epicondylitis, also known as golfer's elbow, shoulder sprains like rotator cuff and AC, knee pain like meniscus and ligament injuries, IT band injuries, foot problems like ligament and plantar fasciitis. The people I treat come from Truckee, but also come from places far away because of the level of care. I treat recreational, professional, and amateur athletes, moms, musicians, contractors, office workers. I treat healthcare professionals, chiropractors, acupuncturists, massage therapists, physical therapists, medical doctors, surgeons, EMTs, nurses. If you want to get better fast and stay that way, call me and make an appointment. Or if you have questions, 530-550-1688, or go to my website, truckeechiropractor.com. Thanks.